Music can have a positive effect on healing.
That's why Norwalk Hospital has integrated music into its therapeutic care for patients.
We'll talk more about music at the patient's bedside on this week's Health Talk. We're up next.
Hello, I'm Dr. Eric Mazer.
And I'm Dr. Vicki Smetak. Today we're going to talk about the role of music in healing. Our guests are Gabriel Litt and Karen Nisenson, who are with Arts for Healing in New Canaan.
This is a wonderful show. I've been looking forward to this all day.
Thank you.
Tell us a little bit, music, as a physician, I'm very left-brained. You just don't think about music and therapy. How did you each get interested in music therapy? Ladies first?
Well, I started out on a very conservatory piano track. I started Juilliard in New York City as a young child, and I went through a master's program in piano performance. I was also interested in composition, and I had this composition teacher who gave very interesting exercises about chords and intervals and different things we had to do. And I used to talk in the class about how different chords and different notes affect feelings. I didn't know anything about music therapy. And this was a composition class where nobody really cared about this topic very much, obviously. And she said to me one day, she said, you know, you talk like my friend Paul Nordhoff. And Paul Nordhoff was really the pioneer of music therapy. And she knew him because they used to go to the MacDowell Colony every summer, where writers and artists and musicians would go to do their work. And so she brought a film in to school the next day, and it was a black and white film of Paul Nordhoff, who was a composer, and Clive Robbins, who was a special education teacher in England. And the film showed how they started this work in Europe. And I was so moved, I said to her, I can do this. I want to do this. And that's how I got into the field, and I met Clive Robbins and got affiliated with New York University, went there for another master's, and that's basically, in a nutshell, how I got into the field.
No, that's a great story, and we'll talk a little bit more, obviously, about the field.
Yeah.
Gabriel, your story is a little bit different. I know you're in the field more recently, and you have more of a rock star background.
Yeah,
Tell us a little bit.
Well, rock star, certainly rock and roll.
Aspiring rock
star. I came in it as a musician who I think I just had a lot of experiences working with kids also as when I was younger, and I just saw how much music could move people, particularly the special needs kids, and I was very moved by how much music could affect them and how much I could really communicate with them, and it just made me realize that music is too important to just be a performance thing. I wanted to learn how I could use it to do more
for therapy.
Yeah.
Right.
So is this something you both do full time?
Yeah, very full time.
Yeah.
All the time.
So you mentioned Karen, children with special needs. I know that Arts for Healing focuses a lot on that patient population, and then of course we'll talk also about using music and art therapy in the hospital setting in terms of not necessarily children with special needs, but just children who may be completely typical but have an intercurrent medical illness that they're hospitalized for. But tell us first about the role of music therapy in autism, or children who have developmental or physical impairments.
Well, music, as everyone knows, affects feelings. You go to the movies, you hear commercials, everyone is affected by music. And it is the quality of rhythm, melody and harmony, the elements of music that are used for communication, for self-expression, for reflection and engagement. Can I ask you a quick question
there that's really, is this true, is the same emotion elicited across all cultures? Is this something that we're wired into?
Absolutely.
I think emotion is elicited, but how it is elicited, or the type of emotion, might be a little bit more individually specific.
Yeah.
But emotion itself, affect, yes, I don't know, but that's a matter of
And our brains are definitely wired for music.
Right.
The whole brain processes music on both left and right. The limbic system, everything is used in processing music. So everyone is open to experiencing.
Can I ask a really silly question? I'm sorry to divert this, it's just so interesting. Are animals affected by music? Have people studied animal behavior and the effects of music?
They have.
Probably. I'm sure some studies have been done. I know in my experience, I knew a dog growing up that loved Bob Marley. That's anecdotal. I don't know if that would count.
Actually, in 1968, somebody did a study on plants and music through
Do they grow better
research.
if you sing
And
to
they
them?
had classical, they had pop, jazz, and they had heavy metal. And of course, as you expect, the classical music did the best. And the heavy metal plants, it said in the report, withered and died.
Wow.
I'm quoting.
Now, do you take offense at that, Gabriel?
Oh, yeah.
No, heavy metal, very heavy
that's-
metal. No, he doesn't do that.
Plants are fragile.
You must have some good anecdotes then from your experiences, either of you, with the patient population that you deal with regard to children who are maybe not verbal at all, and progress that they've made once their parents have implemented music therapy or exposure to music in a therapeutic way to their regimen. Can you tell us a little bit about that?
Sure. Do you want to talk about one of your clients?
Music is ideal for fostering connections and for really creating the bridges between people so that we can have a relationship through which development can occur. And music, as Karen said, it lights up the whole brain, so you really can get through a lot of the deficits that might be there by various disabilities. And so for instance, when I have so many stories. I don't know a particular story, but when just these moments where you just get through to the child and they look, then all of a
there's
sudden
that moment of recognition or connection.
I would like to add, music also encourages language because it's able to take the stages of development in children and babies in language development and recreate that for children on the autism spectrum or children who, for some reason, apraxia or other situations, did not talk. So just as a baby babbles and then goes into one syllable, two syllables, one word, toddler, one or two word sentences up to 2 years old, music allows the therapist to use that development to encourage language. So you can give a child a microphone and go ba 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 la la la, do the babbling, and they do, and it encourages speech. So I've seen a lot of kids who come in who did not speak, and I know Gabriel, through improvisation, through music, allows that child to recreate the developmental stages that they missed because of their disability.
And that must be so amazing for the parents to watch, and a child who really was very limited in terms of their interaction, to then finding this new vehicle through which they can now connect with their child.
It's a new discovery.
Sure.
They get to know their child as opposed to looking at their child with a problem. Now they appreciate and they can be more open to loving that child for who they are. That's what we bring.
You talk about a very interesting connection, because I know that stutterers can sing without stuttering, but they stutter. I think even some of our patients who've had strokes and are aphasic, it's a way of helping to redevelop the language through song. How does that? Do you work with those types of patients as well?
Well, I worked on the rehab floor at Norwalk Hospital for a while, and worked with many clients with traumatic brain injuries, and really got to do some amazing work with some amazing patients there, that just helping them relearn how to talk and through singing. And it was amazing that people that couldn't say their name, you get that right song, and you just get the right stimulus, and there they were, and they were singing with you.
And they couldn't wait till your next visit. I can tell you, very popular up there. And now you also, we have the program that extends to the pediatric unit, and there's a lot of research that shows us that having music therapy in the pediatric population is very helpful in terms of getting children comfortable with procedures, taking away the fear of being in the hospital. And we actually have a video of you, Gabriel, performing in, I think, on our pediatric ward. So
let's take a listen.
Yeah.
Comes the sun, I said, it's alright. It's been a long, cold, lonely winter. Little darling, it feels like years since it's been clear. Here comes the sun.
Well, Gabriel, what are you doing here?
I'm playing the classic George Harrison song, Here Comes the Sun. I think it's a very useful song. It's a song a lot of people recognize, and a lot of people are very comforted by things they recognize. It's also a very beautiful song. And
Is this on a pediatric, well, I now see the play horse. Is this on a pediatric floor? And there are kids in the playroom?
Yes, here is kind of an interactive, I believe, yeah, this song was, this is an improvised song inspired by one of the patients who just kind of sang that little melody, do-do-do, everybody needs to do-do, and we just spun out a song with it, yeah. And
so you do a lot of improvs then.
A lot of improv.
That's really what doing this on the fly is all about, coming to the hospital and working with the individual patient.
Right. The idea is you have to meet the client where they are in any part of music therapy, whether you're in the hospital or working with children on the spectrum.
Karen, how do you do? You obviously, your instrument is a lot bulkier than a guitar.
Yeah, I'm not a great guitar player. I'm a pianist, and I use the piano in improvisation. I use other handheld instruments. I actually use guitar even though I'm not a great guitar player. It just shows you can improvise with anything.
Is it the same kind of approach that you each take to find something that will connect with
I would be honored to think that I could use Karen's approach.
It's very kind of you. But being in music therapy, you have to improvise because it's about spontaneous connection. It's about spontaneous communication and symbolic form as representing the language. So if you have a nonverbal child, you get the mood, they give you a note on the piano with their finger, or they bang a drum, or they play a xylophone. You make music out of that. You have to make music out of anything, even screaming.
Right. Contextualizing their
that's what it's
output,
about.
and that's how you can foster the connection.
Right. So
it makes me think of Close Encounters of the Third Kind, where they
absolutely yes.
This is my left brain working here.
But that's true because the intervals musically are very mathematical in what they used in that movie, and anyone who knows music understands what the fifth is about, and it's a language. And
so you understood what they were saying to each other.
Absolutely. I love that movie.
Well, this is just incredibly interesting. We have to close out this segment, but we'll have you both back in just a minute after we view these messages.
We got the spirit, we're hot, we can't be stopped. We got the spirit, we're hot, we can't be stopped. We're gonna beat them and bust them. Beat them.
The smallest moments can have the biggest impact on a child's life.
Let's get a little bit rowdy. R-O-W-D-Y.
Take time to be a dad
One more
today.
time. All those boys are much too much. Those boys.
When I grow up, I want to be a fireman, cause it's like the coolest job ever. They get to save lives, and who doesn't want to do that? They get to ride on those trucks and never have to stop for red lights or nothing.
If your child is sick over and over again, it could be PI, a defect in the immune system that affects millions. Early detection can give children a chance to dream.
And that pole you slide down? Cool!
Salad on Saturday, fruit on Friday, throw a ball Thursday. Water Wednesday, touch your toes Tuesday. Let's move Monday, swap us next Sunday. 60 minutes of physical activity a day and eating well can help get your child healthy. So keep them active and eating well every day. Get ideas, get involved, get going at letsmove.gov. That's letsmove.gov.
The first 30 seconds are all I remember. My doctor told me I had cancer. When the shock was over, I met with a cancer specialist at Norwalk Hospital. We weighed all my options: surgery, radiation therapy, chemotherapy, even the latest clinical trials. Their Whittingham Cancer Centre offered me personalised care, hope and leading cancer physicians. And I know great care. Besides being a cancer survivor, I'm also an ICU nurse, and I chose Norwalk Hospital.
Hi, we're back with Gabriel Litt and Karen Nisenson, music therapists.
Yes, and Gabriel, now you've been working with us at Norwalk Hospital for, I would say, at least 2 years, maybe going on a little bit more. And you mentioned the work that you had done on the rehab unit, and of course you also come and see pediatric patients at the hospital, who are inpatients, I should say. And we saw the clip of you playing in our playroom. Now, what has that experience been like for you, and what types of patients do you encounter? Do you encounter patients who are very fearful of being in the hospital and who may not want to engage with you right away, or do you find that as soon as you knock on that door, you're warmly received and you go into a jam session right away? Or is it a combination of that?
I think a combination of the two, and I think you really touched on a great point. A lot of the reason why I'm there and why it can be useful is that it's very scary to be in the hospital, and one of the things that I can help do is through music and through humor and through being a relaxed person that is not a doctor, that I can try to meet other needs that they have and try to help them relax, help them be calm, help inform them about their situation, and which lowers the anxiety level and helps them heal. Also, one thing that music therapy is useful for in the hospital is really, dealing with the emotional needs of the client, which, the nurses and doctors are very, very busy. You guys have to deal with all these physical needs, and it's hard to really get a chance to meet, the emotional needs. So I can listen, and I can often, it takes a while. It's the sessions, you have to creep into sessions, and eventually, that people will open up and start talking about their fears and their needs, and I find that it's very useful for them.
And as I hear you talk, Karen, I'm an internist. I deal mainly with adults. It seems this would be also valuable for the entire adult population.
Absolutely.
Are there music therapy programs working on the general medical or surgical wards?
Well, more and more around the country and in Canada. I'm very familiar with research studies being done about music in the hospital setting, whether it's in the actual surgery or pre-surgery. They show that the heart rates relax and the blood pressure goes down, and it really affects the physical and helps people relax and heal.
In oncology,
I know that it's used, and I think that there's music therapy in our oncology program at Norwalk, and it's certainly, there wasn't when I practiced. It's interesting, this engagement of the spirit of the oncology patient really is more, seems like it should be basic, but it really is more recent in oncology.
And it's exciting for us in the field to see the awareness growing globally, that music is a very powerful tool in healing, whether it's the hospital setting, whether it's emotional, whether psychological.
In music therapy, is it a one-on-one relationship that you're trying to create with an individual patient, or do you do it in groups?
It depends on the context. We do, I work at the high school, and we do big groups. I work at Waveney Care Center. We do big groups of seniors there, and then there's a lot of individual. At the hospital, it's typically one-to-one. It depends on the context.
We have infection control, issues and things like that a lot of times in the hospital as well. Now, you also go in with patients when they're undergoing a painful procedure, for example. Can you tell us a little bit about that?
Procedural support is a very big part of medical music therapy, and there's more and more research coming out about that. I feel like the research is starting to catch up with what seems obvious, but I think that it's about keeping the anxiety level low beforehand and keeping the patient as calm as possible, and then continuing the music, keeping that flow going, and it really can help lower the pain.
Sure, like a child who's going in for an IV insertion or some other sort of traumatic procedure, which everything you do to a child in the hospital is perceived as being traumatic.
And there's principles that they teach, the ISO principle of kind of matching their level of anxiety, and you can match it, and then when you're there with them and you have that connection, then
you move with music. You match it musically.
You can bring them down, and it's very pertinent in NICU work. I know there was just a big article in the New York Times about the Beth Israel Beth Israel has a great music therapy program in New York.
In their neonatal intensive care unit.
In the NICU unit, and that's a big principle there, where they can help. You can really see the heart rates going down, feed better.
Karen, what makes a good musical therapist? Yeah.
Well, just look at Gabriel and you'll have the answer. An open personality, a good musician, good training musically, psychological awareness, and
do you get psychological training as well as musical training in order to make?
Yeah, I think that's very important. Yeah. And study keeps going even after you finish school. There's no end to how much you learn, and also willingness to play, being open to play, and being able to let go and be free to just accept a play mode of relating. That's very important. So
to be able to improvise, to think on the
be able
spot
to improvise, and the better musician you are, the better you are at improvisation.
So we're going to ask Gabriel to do some of this right here.
Yes, that would be
because
great.
We don't want to run out of time,
Yes.
and you've promised to engage us and show us a little bit of how you would approach one of us as children or as adults or whatever.
Tell me what's ailing you.
My age, my back, and my joints.
You know, I wish I could say there was just a song I could play to help with your age, but you know, maybe perhaps we could, sometimes just kind of singing a song together, something that puts everyone at ease and just kind of helps you reflect, or perhaps obviously every situation's different, so I'm not sure what to do. But you wanted to see some improv. So what can I do for you?
As busy physicians, we're always feeling stressed and under time pressure.
Something that'll
and
get
how
us
do
relaxed.
Relax. Well, okay. A lot of the work in the pediatric unit, I found myself helping mothers put their kids to sleep. And with my new baby, I'm finding this to be a very useful skill.
Right, you have a 4-week-old at home.
Yeah, I have a lot of sympathy now for these. I've learned a lot. And so, there's an idea of lullabies tend to have a 6/8 feel, which is
rocks you.
Yeah, it's like a rocking motion, and so and
I feel my heart rate going.
And so, I could do this and just sit at the bedside with the kid for...
And then make up words.
Yeah, and say... Or no words, it depends on the situation. If he's sharp and he has things to say, then we'll write a song. If they're just trying to go to sleep, or a baby perhaps, I could just hum.
Yeah.
And, there's no
Right, it's not cookie cutter, and I think that's an important message to get out there.
Yeah.
They're not, there's not, the song that you play when you're putting an IV, the song you play when for an autistic child, there's no recipe.
Cancer
it's
song,
just,
right? It doesn't work like that. I wish it did. That'd make our jobs a lot easier, I'm sure, but
less interesting.
Way less interesting.
Right. Yeah.
So maybe we'd say good night. Sleep time. Good night. Sleep time.
That was very relaxing.
Thank you.
It takes us a while to come up with a question now that we're so relaxed. No, that's wonderful. But you're really speaking a different language to patients, aren't you? This is really...
Well, it's not a different language. It's speaking to them directly. It's their language. It's whatever language they feel comfortable communicating in. It's a feeling language. It's a nonverbal language. It's the silence that exists in all of us when we feel and think and don't speak. And music is able to tap into that very special place in people that need to be touched.
Do you have any special stories that you can relate to us, specific, you know, without violating anybody's confidentiality?
Do you want a child, adult, or older
Take your
person?
pick, whatever,
I have
whatever moved
hundreds
you.
of stories.
Yeah.
I mean, I'll tell you about this adult because I think it's, I mean, I have a lot of stories, but this man came to me years ago when the organization was just beginning, and he was he had severe seizure disorder and had a brain cancer and had an operation that left him like a vegetable, and he still had an inoperative tumor. So he came to me, and he was about 300 pounds and barely spoke and barely could move, and I thought, oh, what am I going to do with this man? And he said the words, "I want to be a musician." And he was incapable of doing anything. And to make a very long story very short, time went on, I got to know him as a person, and slowly, as you peel an onion, I discovered that this man was a wonderful, spiritual, beautiful person underneath who could write poetry and music. And so we put poems together, word by word. It took a year maybe to do one poem because he would only say one word and then another word. It was very slow because he could barely speak because of his seizure disorder. And then I called a friend of mine who's a singer-songwriter, Daryl Tukes, who people may know in the area. He's a local person around here. And together we produced a CD and put this man's poetry to music. And he was the boss in the studio. He nodded when he liked something. He said no when he didn't like something. And then his mother died after that. He had 12 siblings who never knew that he was this person. They all thought he was a vegetable, and it was the music that made him be real. So then the mother died, but the next year, and I want to say
we have
finished.
No time left, so
he died. He died.
So it was so important that
and at this,
completed.
he died right after that. And at the funeral mass, they said he was a musician. That was the first sentence that the priest said. So it was a full circle, beautiful story that left everyone who knew him with the belief that music is so powerful.
Yeah.
And that's where we have to close the show.
Yeah.
Okay, I'm glad I got the rest of the story.
No, I'm glad you did.
But it was
Thank
beautiful.
You so much. I don't know what to say after all of that. We're looking for questions, so if you have a question you want to ask on Health Talk, please contact Vicki and me at healthtalk@norwalkhealth.org.
We would like to thank our guests today, Gabriel Litt and Karen Nisenson, for coming on the show, and see you next week on Health Talk.
It's always nice to come home, but many Americans are at risk of foreclosure and losing their homes. Making home affordable from the U.S. government has already helped over 1 million struggling homeowners like these. The sooner you act, the better chance we can help you.
I'm home where I belong.
The first 30 seconds are all I remember. My doctor told me I had cancer. When the shock was over, I met with a cancer specialist at Norwalk Hospital. We weighed all my options: surgery, radiation therapy, chemotherapy, even the latest clinical trials. Their Whittingham Cancer Centre offered me personalised care, hope and leading cancer physicians. And I know great care. Besides being a cancer survivor, I'm also an ICU nurse, and I chose Norwalk Hospital.
Did you know that getting up and getting active for just 60 minutes a day is all it takes to help you get stronger, look better, and feel great?
Or that fresh fruits and veggies aren't just healthier and crunchier, they can taste better too?
Eating better and getting more active is easier than you think.
Yeah! Keep watching for some fun and easy ways to discover the magic of healthy living in your life.
America.
Let's get healthy together!
Oh, those boys are much too much. Those boys are much too much. We got the spirit. We're hot. We can't be stopped. We got the spirit. We're hot. We can't be stopped. We're going to beat them and bust them. Beat them.
The smallest moments can have the biggest impact on a child's life.
Let's get a little bit rowdy. R-O-W-D-Y.
Take time to be a dad
One more
today.
time. All those boys are much too much. Those